Hello everyone, my name is Dr. Jacobs. I'm a doctor of physical therapy and I'm an inventor of ASTR specialty. I'm also a cancer survivor and I used to suffer from chronic migraines, headache, pain and fatigue before I invented ASTR specialty. Right, Vincent, tell me what's going on with your shoulder, what happened?
So I've had a baseball injury, like throwing injury
Okay.
on my shoulder,
Mm-hmm.
probably from overuse.
Mm-hmm.
I got this was back in the beginning of January, beginning of
This
the year.
year, so we are in September, not September, July.
Yes, yeah.
July, so 7 months.
Yeah, and then I had MRI.
Mm-hmm.
They said the labrum was fine, rotator cuff is fine,
Mm-hmm.
but that I have bursitis, and I've just been having like clicking and catching and
Mm-hmm.
even grinding all
Okay.
over the shoulder,
Mm-hmm.
and it just hasn't gone away.
Okay, so for the last 7 months for your shoulder, so what kind of treatment did you have?
Massage, more than
Massage.
anything. Yeah, a lot of massage therapy.
Did you see any physical therapist to work on that?
So far, no, I haven't.
Mm. So what's difficult for you to do because of this issue?
Well, throwing actually, because
Mm-hmm.
when I throw now, it
Mhm.
feels just like the velocity is drastically slower, and it just
Mhm.
feels difficult to drive it down. I feel
Mm-hmm.
significantly weaker in an overhead position.
Overhead position.
Yeah.
So how much pain do you feel at worst from 0 to 10 in this emergency room?
Probably
At worst? Let me
6.
through. 6? Okay, so if we want to aggravate your symptoms now, what we can do?
I do literally just throwing. Yeah.
Throwing. What about, let's try to do like bring your arm up, like
Oh yeah. Probably bringing it up is pretty uncomfortable.
how much from 0 to 10?
Like 5.
5. So the thumb up here and bring it up this way. How much from 0 to 10?
That's just like a sharp little sting.
Yeah, I can see it like it's a little bit shaky there at the end.
It is, yeah. It's probably like a 6 or 7.
6,
Yeah.
7,
Yeah.
thumb up and bring it up this way. And toward your ear. How much?
That was like probably a 6 also. Yeah.
6. You limited a little bit. Okay, can you do this? So I will assume no pain as long as you're not saying anything, okay?
Okay.
Bring it back like this. So flexion and abduction, that's what aggravated.
Yeah.
And throwing.
Yeah.
So that was 6, 7, flexion and abduction.
Mm-hmm.
Okay, so we'll have you come outside,
Yeah.
we'll do the throwing, and you'll tell me how much pain with that. So this is the 3rd time. This is the 4th time. How much is now?
It's like a 7, 8. Yeah.
It's in the front.
Yeah,
right?
more so in the front.
More in the front. Do you feel it deep inside?
I feel like on the surface, yeah, and deep inside too.
Okay. So, alright, so while I'm working on it, make sure everything pain-free, okay?
Yeah. Got it.
Tell me what's going on with your elbow.
The elbow.
Yeah.
When I was 15 years old, back in 2013,
Mm-hmm.
I broke the elbow.
Mm-hmm.
I guess what you would call the funny bone.
Mm-hmm.
And I got 2 screws put in.
Mm-hmm.
Uh,
You feel the tightness here?
I feel the tightness. Yeah.
That's very tight fascia. Your normal fascia should move like this. Feel that?
Yeah.
And when you have fascia tightness, it's
Right.
like you're wearing a t-shirt 2 to 3 sizes too small.
Yeah.
So I invented those tools to release the fascia. So yeah, go ahead.
And then, so I apparently did have scar tissue there
Mm-hmm.
in that elbow, which
Mhm.
was what I guess you could say was taken care of at the time,
Mm-hmm.
with like, hand massage.
Mm-hmm.
And then I had from
Mm-hmm.
from probably the very end of 2015, back
Okay.
in like November, December.
Okay.
All
We are
the-
2019. Okay.
Yeah,
Mhm.
all the way to
Mm-hmm.
July 2018.
Mm-hmm.
I had throwing problems
Wow.
and
Mm-hmm.
like decreased velocity
Mm-hmm.
by a lot
Mm-hmm.
and a lot less control
Okay.
throwing. And I
Mhm.
found out that was my UCL ligament. It was
Mhm.
just sprained
Mm-hmm.
to, yeah, almost to the point where I needed Tommy John,
Oh wow.
even without it tearing.
Mm-hmm.
And then that was also I'd say that was taken care of through massage, but then I started throwing,
Mm-hmm.
and along with this shoulder injury that happened in January,
Sorry to interrupt you. You feel this big knot here.
I do
Feel
feel
that
that. Yeah,
knot?
I never
You
thought
feel
that was
that?
a knot. Yeah, that's.
That's a scar tissue.
Oh.
So I have this tool to really go deep to release it. Do you feel that knot? Yeah, that's a
I
scar
do
tissue.
feel that.
Go ahead.
Oh, yeah.
Make sure it's not painful, okay?
Okay.
Okay.
Yeah, that's pretty sharp.
Pain?
Well, no.
You're gonna feel
sure.
pressure. Pressure
Yeah,
is
cool.
normal, but pain, just let me know.
Yeah,
But it's okay to feel pressure, but I don't want you to feel pain, okay?
Yeah.
Let's see. Okay.
Yeah. So then, probably around, say, March, when I was throwing, I was trying to throw through the shoulder problems, but then the velo was going down, you know, and I started to feel like stinging in the elbow again, which I thought was, I was like worried that it was the UCL again, but I guess I got an MRI and a CT scan, and it said that I had a loose body and like and even what's it called, an ossicle, or it's bone spur, whatever you want to call it. And I got surgery just last month, June 7th. Arthroscopic surgery where they took out the loose body and shaved some of the bone.
Okay. You feel the scar tissue. You feel this one. And you can see, if you look at my thumb, it's just rolling over it. You see, it's rolling over. It should not be like this. If it's nice and smooth muscle, it should be feel like nothing rolling like this. And I will show it to you with the other tool, the thickness of the scar tissue. So why scar tissue could be an issue? Because our muscle should act like a rubber band when we contract and relax and stretch like this. When we have a scar tissue, it's like we have a knot in a rubber band. So when the muscle contract, does not go much, and that decreases the range of motion in the elbow, the shoulder, and that could explain why you have that clicking and tightness in your shoulder, and you feel it at the end range of motion because your muscle cannot stretch further to the end range of motion. That's why you're missing 30 degrees abduction and 10 degrees extension, 10 degrees flexion and 30 degrees abduction. So we can see the map of your scar tissue where there's redness.
Yeah.
And with this treatment with ASTR tools, you should, after treatment, when you come back, you will notice that the thickness, the width of the scar tissue start to shrink. So it's basically, I'm shaving it with those tools. Did he work on your tricep? Or?
Yeah, I did. Yeah, a little bit. Yeah.
But they did not work on the biceps.
Is that what?
You feel that one?
Massage on the tricep. Yeah, I did feel like running. The massage on the tricep would relieve some elbow pain, also.
But we have to do both triceps and biceps because you need both to work perfectly for your elbow to have a full range of motion in your elbow. You feel that tightness here in the back?
Yeah.
0 to 10?
1.
Okay, let's do abduction. How's that?
It's probably 1, and maybe not even that. And there was no pop on the way or anything.
So you feel it's going smoothly, is that correct?
Yeah.
Okay. So let's lie on your back. I need to work on your elbow now. Are these tools feel different than massage?
Yeah, because whatever's there, like as you say, the scar tissue, you can feel it. You can literally feel it
With the tools.
with the tools. Whereas with the hands, you feel like you feel the fingers go over it, but this is just obvious.
This is
grinding.
pushing it. This is working on it directly. Action. How's that?
Nothing.
Abduction. How's that?
Maybe you listen to one.
Listen to one. So before we start, his flexion was 170 degrees. Normal is 180. Okay. And so let's try to see how is your flexion. All the way back. So that was 170 degrees. Can you see this? 180 degrees. Abduction was 150. So let's bring it back. Can you see this? 180 underneath my fingers. You see that? The correct answer is yes.
Yes.
Alright. Sit up for me.
Okay.
Any pain or it's okay? Tightness
Almost
is okay.
no pain,
Mhm.
and I feel like I just feel my arm velocity literally coming back.
Coming back?
Yeah.
Beautiful.
Little bit in the front, but
How much from 0 to 10?
like 1, 2.
Okay, let's do a couple of them. But let me know if the pain increase, okay?
Okay.
I want you to suck your stomach while you're doing that.
Okay.
We're gonna work on your body mechanics after the video. Okay? Did you feel it or how is it now?
It's not increasing.
You did 4 now.
Yeah.
How much is now from 0 to 10?
1 or 2. Yeah.
Okay, so you have a minor inflammation. I'm gonna use a Magna-Heal to decrease the inflammation, and we'll have you try it again. You felt it here, you said, yeah?
Yeah.
In the
yeah.
front.
Yes.
Mm-hmm. Sit up nice and tall. Right in here, okay?
Okay.
So if it's a mild inflammation, just a few minutes using this should be enough. We'll have you try to do more throwing and see how that feels. As long as you don't feel pain, we're gonna do, your max was like 4 when we did before,
Alright.
but we're gonna do more now.
Okay.
As long as you don't feel pain, just keep going, but count, okay?
And the elbow feels better too, by the way. Just
The elbow, so what was the symptoms before when you did it in the elbow? Because you did not mention a lot on
Yeah, I did,
the elbow. So what's going on before we do work on the elbow?
yeah, I felt just like a little bit of throbbing in there.
Oh,
and,
when
yeah,
you were
and
doing
dullness.
throwing? Okay.
Yeah, yeah.
hmm
And that was like a 4. Something
Okay.
Like that, and that's gone down.
That's
even-
before with the treatment.
Yeah.
Okay,
Yeah.
and now is,
Probably 1.
okay. So let's do 5 or so or more. As long as you don't feel pain, just keep going.
Okay.
Okay? Any pain, discomfort?
Almost nothing, but like just a little.
You feel pain or tightness? Just a tightness.
Probably
Because
tightness.
you still have a scar tissue.
Yeah, it's
So-
not the pain that I was feeling before. It
It's
was-
just you feel like a little bit tightness.
I-
It's normal to feel that. I expect you're gonna feel it until we totally break your scar tissue. You still have some scar tissue. We did not. Some patient in one treatment should be enough to break the scar tissue, but other patients just take a few treatments. Tightness is okay because we know still you have some scar tissue. As long as you don't feel pain and you feel you have full velocity or range of motion, that's fine. This is just the first treatment, so we're gonna work a little bit more on it. How you feel overall now? So you just did how many? You totally did
5 right now.
5, and how is that now? Give
I
me
feel-
feedback about shoulder and elbow now.
Shoulder feels. I mean, there's no pain after it. Yeah.
Mm-hmm.
And then the elbow doesn't feel like it's throbbing
Mm-hmm.
after I've thrown.
Okay.
It just feels, they both just feel like you said tight.
Just tight.
Yeah.
We're gonna work on it. So you had physical therapy before. So can you tell a difference between what you had before and ASTR treatment?
I feel like that scar tissue that you mentioned with physical therapy, it's usually I was massaged hands
Mhm,
on
mhm.
or with fingers on the elbow and on the shoulder,
Mm-hmm.
and then with the products you just used on me, you literally feel the scar tissue going away as you grind on it, and
You feel
and
it's loosen up, yeah?
and it takes a lot less effort and time.
Mhm.
Like with the massage therapy, I mean, these are like 30, maybe no 20-minute sessions,
Oh my goodness.
Yeah.
I feel bad for them. That's actually painful for them too. Okay.
Yeah. I mean, and those sessions, when it came to the shoulder,
Mm-hmm.
those massage sessions, they didn't, like, I'd feel good for the time being, and then I'd go back to being in pain. Yeah.
So it was temporary.
Temporary, yeah, definitely it was temporary.
Yeah. All right, awesome. I'm glad you're feeling better.
Yeah, thank you.
Yeah, thank you. Okay, Vincent, tell me, how do you feel? Today is your second visit, and we did some work on your shoulder, and you had already physical therapy before for your shoulder. So, can you give me an update? How's everything now?
So, after my first treatment, I had significant strength that I didn't have for the past 5-6 months since January.
And we did not do strength training. We just
we didn't do any strength training at all.
Yep. Okay.
Yeah, and I've tried doing strength training on my own. Never did. It didn't help until we did the treatment, and the range of motion is better. I get less clicking. I have significant strength. After the first one, I was like 90, and I went a week. It's been 2 weeks since the last time I've seen you.
Yeah, so the first treatment was 2 weeks ago.
2 weeks ago. Exactly.
Now the second treatment in 2 weeks.
Yeah, so I maintained that strength from that. And then I had like maybe 90% strength. Now I feel like close to 100. Like this feels great. Yeah.
That's awesome. And I went over your throwing format because we had to change some your body mechanics. So I want you to actually do the throwing, and after you do it, tell me how you feel. Do you feel pain, soreness, and what the difference from the feedback I gave you to really work on changing the way you throw. Okay?
Yeah.
Okay. So we'll throw. We'll do 5 total, okay? We've been doing today, actually, this is almost like the 50 throwing today, but we just record 5 here, okay? Alright, so feedback before and after the treatment, the way you throw and everything.
So before when I would throw, it felt like my arm was just slow and it almost couldn't keep up with with the movements that I was trying to do. And now, now it's just obvious. It's just it's freer. The arm speed is much faster. Yeah.
Any pain, soreness, anything?
Yeah, no pain. Before I was feeling pain
immediately
in the back of the shoulder, and now it's nothing. Yeah, and I'm
what,
going full force.
What about your body mechanics? I can see totally huge difference if you watch the original video and now, body mechanics. Can you give me
my posture, walking and throwing, and just sitting, standing, my shoulders were, I don't even want to do it, but
yeah,
but
you look much better.
Yeah, me thinking I was normal, really my scapula was all tilted forward and everything, and my shoulders, everything, and now, with some simple cues, it feels different. It feels a lot freer. My shoulders feel freer to move and everything, and it's becoming a lot more natural.
Beautiful.
Just one day.
Yeah. So you had physical therapy before. How long do you had the physical therapy for? Shoulder, elbow?
Probably like 3 or 4 months on the shoulder, working a lot of massages.
How many sessions a week?
One, but every week.
Every week for 3-4 months. Okay.
Yeah.
You had 2 ASTR treatment. What's the difference?
It was a much bigger difference, and it seemed like a lot less effort.
Yeah.
Yeah.
Short period of time.
Yeah.
All right. Awesome. Thank you so much.
Thank you.
Thank you. Free to subscribe to my channel to get helpful tips on how to relieve pain and watch real treatment videos. There are over 45 studies that support ASTR treatment model. If you are a patient and would like to schedule an appointment or treat yourself at home, check the link below. If you are a healthcare provider and would like to receive ASTR training and buy ASTR instrument, check the link below. See you soon!